Breaking news. Top doctor calls for cancer warnings on alcohol as new research links it to 7 types of the disease. America's top doctor has called for warning labels on alcohol, highlighting the link between booze and cancer. U.S. Surgeon General Dr. Vivek Murthy issued a new advisory this week recommending that all alcoholic beverages include a cigarette-style warning on their packaging. He said that research from other countries had shown that pictures showing the health effects of smoking would work better for alcohol. Alcohol is one of the leading preventable causes of cancer in the U.S., the advisory notes, linked to nearly 100,000 cancer cases and about 20,000 deaths each year. Research over the past 4 decades has revealed a causal relationship between alcohol use and increased risk for at least 7 different types of cancer, including of the breast, colon, liver, and throat. Labels currently printed on bottles and cans of alcoholic beverages include small text that warn about the dangers of drinking while pregnant or before driving and operating other machinery. However, Dr. Murthy says the label statement, which has remained unchanged since its inception in 1988, should be amended to warn of alcohol-related cancer risks. Looking to other countries for inspiration, his advisory notes, there are 47 countries that require alcohol warning labels related to health and safety. South Korea requires a cancer-specific warning, and spurred by existing evidence, Ireland signed into law a new requirement to display a cancer warning label on alcohol-containing beverages starting in 2026. This label will state, there is a direct link between alcohol and fatal cancers. The Surgeon General's advisories are public statements that are designed to call the American people's attention to a critical public health issue. Dr. Murthy does not have the authority to push through policy changes himself, but his recommendations can have influence on hospitals, local and state health departments, and other government agencies. He highlights in his latest advisory, the power to change the label statement lies with Congress. It is unclear whether a Republican-controlled Congress or incoming Trump administration would back the move. Trump is famously a teetotaler, and his nominee to be the head of Health and Human Services, Robert F. Kennedy Jr., is a former alcoholic who has backed calls for tighter regulation around another industry heavily linked to cancer, junk food. In his advisory, Dr. Murthy warned the more alcohol consumed, the greater the risk of cancer. For certain cancers like breast, mouth, and throat cancers, evidence show that this risk may start to increase around 1 or fewer drinks per day. And when it comes to the types of alcohol linked to an increased cancer risk, the experts say the link still stands regardless of the type of alcohol. In terms of how alcohol causes cancer, the advisory says there are 4 distinct ways that it works inside the body. First, alcohol breaks down into acetaldehyde once it is consumed. Acetaldehyde is a substance that causes cancer by binding to DNA and damaging it. When DNA is damaged, a cell can begin to grow uncontrollably and create a cancerous tumor. Second, alcohol generates reactive oxygen species, which increase inflammation and can damage DNA, proteins, and lipids in the body through a process called oxidation. Thirdly, alcohol alters hormone levels, which the experts say can play a role in the development of breast cancer. And lastly, carcinogens from other sources, especially particles of tobacco smoke, can dissolve in alcohol, making it easier for them to be absorbed into the body, increasing the risk for mouth and throat cancers. In addition to updated labeling, Dr. Murthy has made a number of other recommendations, which include reassessing recommended limits for alcohol consumption. The current U.S. dietary guidelines currently recommend that American men should consume no more than 2 alcoholic drinks a day, and women should consume no more than 1 alcoholic beverage per day. It defined an alcoholic beverage as a drink that contains about 14 grams of pure alcohol, equivalent to 1 regular beer, 1 glass of wine, or 1 shot of spirits. For decades, studies suggested that there was some benefit to drinking moderate amounts of alcohol, which was thought to be linked to its de-stressing effects. But in recent years, research has swung the other way. The new dietary guidelines will be published in 2026, and it is believed that Americans could soon be urged to drink no more than 2 bottles of beer or glasses of wine per week. The guidelines will eventually be signed off on by the U.S. Department of Agriculture, USDA, and Department of Health and Human Services, HHS. More than 60 million Americans report binge drinking at least once a year, and on average Americans who drink alcohol say they consume about 4 alco.